Have you ever felt your heart thumping in your chest after a few drinks with friends? Or maybe your smartwatch buzzed, warning you about a spike in your heart rate after that second glass of wine? You're not imagining it. Alcohol definitely makes your heart beat faster. But is it just a harmless side effect of a good time, or is it something more serious? Let's get into it. The short answer is yes, drinking alcohol increases your heart rate. Your watch was telling the truth. But whether that's dangerous is a bit more complicated. Experts agree that if you drink, moderation is key. Alcohol affects our health in many ways, and when it comes to our hearts, there are some real concerns. So why does this happen? Isn't alcohol a depressant that's supposed to relax you? Well, yes, but not in the way you might think. Alcohol actually slows down your brain's control over your body. At the same time, it causes your blood vessels to dilate or widen. To keep blood moving effectively through these wider vessels, your heart has to pump harder and faster. That's why your heart rate, the number of beats per minute, goes up. On top of that, alcohol is a diuretic. It makes you pee more, which can lead to dehydration. When you're dehydrated, your blood volume decreases, and your body tries to compensate by, you guessed it, increasing your heart rate to pump the remaining blood more rapidly. You might have heard of holiday heart syndrome. This term describes when people who don't drink often suddenly experience palpitations or an irregular heartbeat after drinking more than usual during a celebration. It's a real phenomenon linked directly to this process. Now, you might think how much your heart rate increases depends on things like your size. People often say a big guy can handle his liquor better, but that's a risky assumption. Body fat, underlying health conditions, and individual metabolism play a much bigger role than just size. The long-term effects on your triglycerides, weight, and blood pressure can be significant for anyone, regardless of their build. So you can't just assume you're fine based on generalizations. It's crucial to know your own body and its limits. So when does an increased heart rate become dangerous? A temporary bump isn't always a problem, but if you have an existing heart condition, it can be risky. One of the heart's most important jobs is to maintain a steady rhythm, typically between 60 and 100 beats per minute when you're at rest. Alcohol can push your heart rate above 100 beats per minute, a condition called tachycardia. Frequent episodes of tachycardia can lead to serious problems over time, like heart failure or an arrhythmia, which is an irregular heartbeat. The most common type of arrhythmia is atrial fibrillation, or AFib. This is when the heart's upper chambers beat chaotically and out of sync with the lower chambers. AFib significantly increases the risk of stroke and heart attack. This is why knowing if you have a pre-existing condition is so important. If your resting heart rate is normally 60 and it goes up to 80 after a drink, that's generally not a cause for major concern. But if you frequently feel palpitations, get lightheaded, or have a diagnosed arrhythmia, drinking could be putting you in real danger. In these cases, the safest choice is to avoid alcohol altogether. So what can you do to manage this? The simplest and healthiest answer is, of course, not to drink, but we live in a social world, and that's not always the choice people make. If you do choose to drink, the key is to stop at one. Research shows that one standard drink, that's about a 12-ounce beer, a 5-ounce glass of wine, or a 1.5-ounce shot of liquor, has a limited effect on your heart rate, and only for about 6 hours. But if you have more than that, say 2 or more drinks, your heart rate can stay elevated for up to 24 hours. The message is clear. Moderation makes a huge difference. If you're going to have a drink, sip it slowly, enjoy it with some food, and most importantly, hydrate. Have a glass of water between alcoholic beverages. This simple step can help counteract the dehydrating effects of alcohol and give your heart a break. Your body will definitely thank you for it. In the end, it's all about being informed and making smart choices for your health. Being aware of how alcohol affects your body is the first step. Thanks for watching. If you found this helpful, please give us a thumbs up and don't forget to subscribe for more content to help you live a healthier life. See you next time.